Okay, future nurses, this discussion is on your general systems theory and how it connects to your safe and to your nursing informatics, no? And basically to safe and quality nursing care and to effective and efficient care. As I have mentioned, when you talk about plus your general systems theory, the main goal plus of your system is to improve the care that you are delivering. When I talk about system in general systems theory class, your general systems theory, as the term implies, general systems theory. Okay, class, it means general. Ibig sabihin, all the systems that are available in the world could be interpreted, could be analyzed using the general systems theory. Okay, so class, in particular, I'm giving you examples that are specific to nursing. Now, allow me to elaborate on some of the assumptions of this theory. Class, first of all, the theory says that all systems must be goal-directed. So whatever the system is that we will be touching on once we are already staff persons, those systems class is considered to be goal-directed. For example, when I talk about a computer could also be considered a system. Plus, ano po yung goal ng computer? The goal of the computer is to make your work efficient. Okay, the goal class of having the computer is to make your work efficient. Okay? Now, another system perhaps that is practiced in the hospital is what you refer to as your, you have class what you call your primary care method. Okay, class, may tinatawag tayong primary care method. Once you are level 4 student nurses, in your leadership and management, you will know that there are different types of nursing modality. And one of it, class, is your primary care nursing modality. Class, when I say primary care nursing modality, ibig sabihin, ikaw na isang nurse, you would take care of the 6 patients. Kaya halimbawa lang yung 6 ha. And then, you will be the one to take care of everything that those 6 patients needs. Okay? That's one system. Class, when I talk about the primary care method, that's one system of nursing care. And again, there is a goal for that, no? There is a goal why we are doing that. So plus the proponents of primary care nursing would even say that your primary care is intended again to improve the quality of care that your patients is having. Next, you have plus a system. It also says that the system is more than the sum of its parts. So again, the common example that I give, that even if a leg would be amputated, even a part of the body is lost, it does not make your patient less of a human. Okay? That's the basis class now. This is the statement where we base it from. Then a system is ever changing, and any change in one part would affect the whole. So when we talk about the system, especially that of the human systems class, okay, it is said to be dynamic. It is said to be dynamic. So if I will apply that to patient care, it does not mean that if you cared for your patient A like this a year ago, it will be the same patient A that you will encounter today. Because your patients class are said to be dynamic, your patients class said to be changing as a system also. Okay? Now, look at yourselves, for example, no? Try to reflect who were you a year ago and who are you right now. Okay? Some of you might say, the same tao pa rin ako. The same pa rin yung principal ko. Pero if titingnan mo, surely there is something that changed within you. Okay? Surely there is something that changed within you. Okay? And that is because you as a system is considered to be dynamic. And then class, a system would have boundaries. And then again, as I said, human systems are said to be open and dynamic. Now, in learning this theory, there are several concepts and definitions that we need to look into. And the next definition here is your closed system. So class, the system could be classified as either closed or open. So class, when I say closed system, the keyword there that you might want to capture is fixed automatic relationship. Okay, there is no give or take with the environment. Now, for example, a rock is an example now of a closed system. As a class, it does not do give or take with the environment. It's considered to be fixed. It's considered to be automatic. Now, look at the open system. The keyword class for your open system is interact with the environment. The keyword there that you have is interact with the environment, okay, by trading energy and raw materials and service produced by the system. Now, guys, try to think. If you are taking care of your patients, if you are working in the hospital setting, or even if you are working in the community setting, what do you think is the type of system that you will encounter? Will there be closed systems or open systems? Anybody?
Open system, sir.
Okay. So class, the tendency is that you are dealing with an open system. Okay? Class, never have you seen in nursing practice that there will be a closed system. Okay? Never will you see that there will be a closed system because you will always be dealing of an open system. Now, here comes somebody who would say, how about those people who are isolated? How about those people who are depressed? Okay? Are they considered to be a closed system or an open system? Students, depressed, isolated. Can you think of patients, for example, or clients, for example, na sasabihin nila, Sir, ma'am, I do not want to go out of this room. Okay, sir, I just want to stay here. I don't want to talk to people. Okay, I don't want to be with somebody else. Are they considered to be a closed system or an open system?
Closed system,
Yes.
sir.
Closed. Yes. How about others? Okay. May ma-vote na open system siya. Okay. Now, class, come to think of it now. Even if your patient class would say that they would want to be isolated, or even if they would say, nurse, I feel very sad about life. I just want to be alone. Class, they are still considered to be an open system. Okay? They are still considered to be an open system. Okay? Bakit ganun yung pag-iisip natin, class? Look at people. People is actually listed as an example of an open system. Now, why do we think like that? If somebody, class, is depressed, as a nurse, we don't end up by saying, hi, depressed siya. Di ba, class? The common language that you would hear is ahay. Di ba? Ahay, no? They would manifest that they would feel pity to that person or the like. But you know what, class? Clinically depressed patients does not actually want to be pitied. Okay? Hindi nila, class, gusto na kinakaawaan nyo sila. That's one thing that you need to remember. And other than that, why did an individual become depressed? What do you think, guys, is the reason bakit yung isang tao nagiging depressed? Can you give me points or examples kung bakit nagde-depress yung isang tao?
Nag-overthink, sir.
Family problem.
Nag-overthink, yes, nagpa-family problem. And class 9 too. Again, yes, Marian, you mentioned something.
Financial, sir.
Financial, okay? About to relate, okay? Anyway, so class, no? Look at that. Financial problem, family problem, social problems, overthinking. When they are doing that, they are actually interacting with the environment. Diba? So class, they are considered to be an open system. Okay? So take note that actually, guys, no, if you understand people with depression, if you understand people who would want to be isolated, that's actually their language that they are calling for help. Okay, that's their language actually that they are calling for help. Kumbaga, the system is already telling them that, okay, I can't handle this anymore. I need help. But they just don't know how to communicate it. Okay? Now, I'm so sorry for those who are going through this. I don't mean to trigger you, but I just would like to point an example as a nurse. No? From a perspective kasi of a nurse, you do not think of them as a closed system. You think of them as an open system. Eh sir, paano yan? Gusto kong kausapin tapos ayaw akong kausapin. Paano po yan? Ano? Paano? Kay closed system din siya, yes sir. Kay ayaw niya akong kausapin. So closed system siya. You know what, class? If you're dealing with somebody who's depressed, what do you think is the best thing to do? A, force that some person to talk, force the person to talk, or B, wait for that person to open up. What do
B,
you think is
sir.
best to bear? Okay, so class, no?
B,
Sir,
sir.
pangit naman kasi ng A, force to force. But class, the point is that you wait for the person to open up. So ano po yung drama natin dyan, no? Huwag mong pilitin na, huy, what happened ba? Bakit ba kayo nag-break? Huwag mong pilitin. Dapat class yung linyahan mo is, okay, I'm just here. Okay? My lines are open in case you want to talk. Kung sa patient naman, class, in the psych unit, ano po yung sinasabi? I will be here if you are ready to talk. Okay? Tapos class, you're just sitting there. Okay? Huwag mong pilitin yung pasyente mo na magsasalita. Okay? So again, class, that's how your open system works. Now, boundary. When I talk about boundary, that is the line point, students. That's the line point where a system and the subsystem could be differentiated from its environment or from other subsystems. Okay? Now, sabi natin, di ba, sabi natin, class, most of the systems that we encounter are open systems. Now, let's pick, for example, patient A. And then, class, let's pick, for example, the mother of patient A. So, class, if you would look at them, okay, they are actually open systems. Sorry, dapat kung nire-represent ko yan ng tama, guys, broken lines yan. Okay, dapat broken lines yan. Hindi ko pa malaman kung saan yung broken line dito. Okay, sa next video na lang ang broken line. Okay, so class, broken line yan kasi open system siya. But now, if you would try to think of it, there is actually a boundary between the patient and the mother. Okay, that would actually differentiate the patient from the mother. Even though, class, they are considered to be open systems, hindi naman, class, everything na alam ni patient, alam ng mother. Hindi naman, class, everything na alam ng mother, alam din ng patient. Mo? Okay, so there is that boundary that differentiates us from another. Now, for example, in my case, we are a system. As a classroom, we are a system. Okay, I'm interacting to you. You're trying to interact to me. You are my environment. Our online classroom is our environment. But plus, there is a boundary, no? There is a boundary. For example, I am your teacher. That's the line, class, that separates us from one another. Okay? So oftentimes, no, although sabihin natin equal tayo lahat dito, tao tayo, pero our roles are different. My role here is a teacher to educate you. Your role here is a student. So your role here is to eat while I'm having classes, okay? Or you're trying to participate, diba? You're trying to participate while I'm having my class. And that class, that role is actually the line point that differentiates you from me. Okay? So there are different line points, di ba? O for example, if we're talking naman about organs of the body, class, you would notice that our organs would have also their own separations. Okay? Di ba sinasabi natin we are one individual here, but if you would look at your stomach is rest assured separated from your intestines, di ba? Okay? May pinagkaiba sila kasi kapag yung acid ni stomach pupunta kaagad kay intestine, hindi naman yan magugustuhan ni intestine. Okay? So there is some boundaries there. If you can notice also, the cells of your stomach are different from the cells of your intestine because they have different purposes. Okay? And then plus, the goal is what you refer to as the overall purpose. Okay? The overall purpose plus of existence for the desired outcome. So, for example, as a teacher, my goal here is to educate the student. My goal here is to support people, for example, as a nurse during illness. Okay? So, kung makikita nyo, class, very wide ang concept ng system. Okay? Very wide ang concept ng system. For example, if I would talk about a nurse's station, okay, class, when I say nurse's station, a nurse's station is a system. Sino po yung part ng system na yan? I have nurse A, I have nurse B, I have the head nurse, I have the supervisor, I have the chief nurse. Plus, the individual staff nurses are also a system of their own. Kasi class, si staff nurse mo, marami din pinagdadaanan sa buhay. So, pwede siyang mother, pwede siyang nurse at the same time, pwede ding clinical instructor siya at the same time. So, basically, your general systems theory just allows you to look at each of this as a system which has several components that needs to work hand in hand together. And these systems, guys, may also undergo what you refer to as your entropy and your negentropy. Class, when I say entropy, your entropy, class, is the tendency of the system to develop order and energy over time. Okay? Ano pong ibig sabihin natin yan? If you're looking at the system, class, the system would try to organize itself. The system, class, has an inclination to organize itself. And one example is, you have your rules, you have your policies, you also have your protocols. Because the purpose of that is to organize. However, there is also negentropy. Class, when we talk about negentropy, class, when you say negentropy, it is the tendency of a system to lose energy and dissolve into chaos. Okay? Now, what does it mean? Now, what does it mean? Example dito, class, hurricane. Or tinatawag po yan natin usually, tinatawag po natin yan usually na force majeure. Okay? Class, pag sinabi ko, class, force majeure, these are calamities. These are calamities. If I would translate the phrase force majeure to English, that would mean acts of God. Okay, class, that would mean acts of God. Okay, ibig sabihin class, wala po tayong magawa bilang human beings, nagka-flood. Wala po tayong magawa, nagka-earthquake. Wala po tayong magawa, nagka-volcanic eruptions. Those are considered to be force majeure. But take note ha, hindi lang po yan ang example ng negentropy. So class, if you won't help class, no, if you won't help ano nga, if you won't help ensure that your system, my dear students, would undergo entropy, it will undergo negentropy. So that's why it is our goal as individuals that we need to ensure that our system would be organized. Okay? Halimbawa, picture na lang the set of friends that you previously had. Di ba class, si friend mo, halimbawa, si friend A, tapos si friend B, tapos si friend C. Close friends kayo. Nag-share kayo ng everything maliban na lang sa boyfriend. So class, here comes the day, for example, na nagtampo kayo. Si friend A at si friend B nagtampo kay friend C. Kasi daw mabaho si friend C, may body odor. Nagpalit ng deodorant, hindi kayo na-inform, so mabaho daw. Plus, if you will not be talking to friend C, what will be the tendency? The problem will become bigger and bigger and bigger. And then it will come the time na wala na kayong pakialam kay friend C, si friend A at B na lang yung magkasama. Okay? That may be a simple example, but you know what? That could happen in your clinical setting. That could happen in your nurse's station. That could happen when we are talking about the systems of our patient's body. Okay? Now, if you would look at the system of your patient's body, plus pag titingnan po natin, why are we having fever? Bakit po tayo nagkaka-fever? Anybody?
May infection, sir.
May infection. Okay, why are we having fever when we have infection? Why is our body having fever when we have infection?
Because of our lifestyle, sir.
Because of our
Lifestyle.
lifestyle. Okay? So class, bakit tayo nagkaka-fever, no? Class, our body is actually warming up because the goal of your body is actually to kill the microorganism. Okay? It's trying to warm up because it's the defense mechanism of your body with the hope, class, that they will be able to kill the microorganism. Okay? Di ba class, once may infection tayo, ano po nangyayari? Mag-activate po yung inflammatory response natin. And because of that inflammatory response, nagkaka-fever po tayo. Sabay po dyan yung inflammatory response, nandyan si WBC, nandyan pa si cytokines, nandyan pa yung mga immunoglobulins, kung sino man dyang part ng immune system mo. Their goal class is to kill the microorganism. Okay? Their goal class is to kill the microorganism. Now, ikaw as a nurse, di ba? Ikaw as a nurse, we are trying to intervene naman sa fever. Sir, di ba, sabi mo fever would try to kill the microorganism. But if my patient class would have fever that is uncontrolled, let's say for example, especially for talking about pediatric patients, kapag uncontrolled fever po siya, ano pong pwedeng mangyari? Sige nga, if uncontrolled fever siya guys, what could possibly happen? Anybody? Sige na. I think you've encountered this. You've heard of people having this. What could possibly happen to a child with uncontrolled fever?
The person's body may will be weaker. Will be severe yung vital signs niya, hindi magiging normal, abnormal, ganun.
Okay. And then class, other than that, no, I don't know if you've heard of the term convulsions already. Are you familiar with convulsions?
Sir,
Okay.
shivering.
Familiar with convulsions? Yes, your seizure. Okay, and then other countries would call it fits, no? So plus that could possibly happen. Okay? Now, ano pong ibig kong sabihin dito if I will apply this on the system? Di ba class, your body is a system. The patient's body is considered to be a system by itself. Plus, the system is trying to cope. The system encountered a problem. That problem is infection. Plus, when that problem occurs, your body would try to kill it by having fever. However, class, if you would not intervene as a nurse, the system is more likely to collapse. So kung kaya when you are applying the systems model, okay, you would also know that there are activities that needs to be done in order class to evaluate the input, throughput, and output in order to make corrections. Okay, and that activity class is referred to as your controls. Okay, those are your examples of controls. Okay, so in this case class, what was our control? We tried to control the fever, and that is using your TSB, and that is using your medications. Okay, that is using your TSB, that is also using your medications. Now, point for example, another naman nga perspective yung tingnan natin. Let's say for example that your patient had fever again. Nagka-fever. Pagkatapos class after, once you discovered that, you already had your TSB. You did your TSB, your tepid sponge bath. Class after the TSB, what will you do as a nurse? Ano ang nursing responsibility mo after you have done your TSB?
Monitor vital signs, sir.
Very good. No, very good. So you need to recheck the vital signs. Halimbawa kasi nagka-fever, ang fever 39.6, tapos nag-TSB ka. After your TSB class, you need to counter-check, particularly after 30 minutes. Dapat i-counter-check mo because you would want to know whether did the temperature decrease to 38.5 or baka nag-increase pa to 40. That rechecking class of your temperature is also considered to be a control. Okay? That is also considered to be a control. Because class, they are used to evaluate your input. Ano ang input mo dito? Your input was the TSB. Your input was the TSB. And you would want to recheck, plus the recheck class would be your control to determine or evaluate whether your TSB was effective or not. Okay? Now, you have equifinality. Class, when you talk about equifinality, it is the objectives can be achieved with varying inputs and in different ways. Ano pong ibig sabihin natin yan? Sabi niya, equifinality. Kung baga, class, the same destination, equal ending din naman. Okay? Which means that if I would want to do this for my patient or no, if I would want my patient to be well, it does not mean that I will only do option A. Okay? There could be option B that will also lead to the patient becoming well. There is option C leading to what the patient could becoming well. Okay? So, ibig sabihin class, if this is my objective, if there is my goal, there are different ways for me to attain it. There are different ways for me to attain it. Okay? So, hindi pa pwede, for example, tayo Angel, may patient, no? Tapos sinabi natin na, uy, yesterday, alam mo, yung fever, binigyan ko lang ng paracetamol, nag-okay yan. So, itong patient na may fever today, bigyan mo lang rin ng paracetamol, magiging okay din yan. No, there are different ways to solve the problems. Okay, there are different ways to solve the problems. Okay? So, okay, marami tayong dapat makitang possibility and you have your equifinality to do that. Kung sa ethics naman natin, parang it would go back to the thought that the ends would justify the means. Okay, kung there are a lot of means for us to reach that specific end. Okay? Now, what are the basic principle of a systems approach? Class, a system is greater than the sum of its parts. No? For example, if I would look at the parts of a human, class, the parts of our parts are, we'll say, for example, 2 arms, 2 legs, plus head, plus chest, plus torso, or plus back. Okay? And the list continues. Now, if I talk about a human being, for example, okay, nawala yung isang finger kasi na-disgrasya, does that make our patient less of a human? Does that make our patient less of a human? No. Kahit plus na wala po yung isang finger ng patient natin, patient is still considered human. Okay? Patient is still human. Now, it also requires class investigation of the whole situation rather than 1 or 2 aspects of the problem. Kung kaya class for example, here in nursing, you are learning concepts like health assessment, you are learning fundamentals, you are learning class your medical surgical nursing. Because, for example, Babae class pupunta sa'yo, no? You picture out a female patient and then your patient class would complain that there are too many hairs. Okay, there are too many hairs on my face. Okay? Marami daw yung buhok, marami daw yung mustache ng pasyente mo. Expected ba yan class sa female na may mga mustache? Di ba? Hindi. Especially dito sa atin kung saan tayo yung mga judgerist, di ba? Kaya pag nakita yung female na may mustache, ay, anong nangyari sa kanya? Nakakadiri. Okay? So class, you as a nurse, do not just only see that patient because of the hairs. Okay? You need to assess the patient. You would want to look at meron nga bang edema yung pasyente natin. Okay? Meron nga bang changes sa menstruation ng pasyente natin. And then class, as a whole, you might be looking at a patient who has a Cushing syndrome. Okay, class, you might be looking at a patient who has a Cushing syndrome. Okay? Because we are looking at a whole, di ba? We are looking at the entirety of our patient. O now, halimbawa, class, may Cushing syndrome siya. Students, pag sinabi kong Cushing syndrome, just think of it as of this time as increase of your adrenal functioning. Okay? Nag-increase po yung adrenal gland functioning. And with that po, naapektuhan po yung salt, sex, and sugar. Okay, these are the three hormones class. I use this mnemonic to remember the three hormones of your adrenal glands. Okay, or let me see. Ay, hindi naka-prepare yung Google. Okay. Okay, let us see if there's a Cushing syndrome here so that you will be able to see and picture it out. Okay. Yan po class ang isang example ng pasyenteng may Cushing syndrome. Okay? If you can see excessive hair growth or hirsutism, tapos may mga presence of stretch marks, okay? Parang ganan, ha? Ladies, I'm so sorry for the image. They just depicted that para mas madaling tandaan yung symptoms. Okay? Now, let's say for example, you're taking care of that patient, tapos alam mo nang may Cushing syndrome siya. You do not just focus on the disease itself. Okay? Now, class parang sama namang sabihin, pero try to think that you are on the shoe of your patient. What would you feel? Sige nga, what would you feel? Anybody?
Insecure.
You would feel insecure.
Bothered.
Yes, An April?
Bothered, sir.
Bothered? Yes, Abdullah Kim?
Tired.
Tired. Okay? So class, no? With that, you always think beyond the symptoms. Because again, what's the type of care that we always push through? Your holistic nursing care. Diba? Dapat holistic nursing care ka. So hindi pa pwede, for example, class, ito yung pinaka-basic example siguro na nakikita nyo sa environment is somebody who has increased blood pressure. Diba class, pag increase yung blood pressure, anong sasabihin? Di ba mag-take ka ng meds para bababa yung pressure mo? Pero class, beyond that, you know what a mother is thinking? Anong iniisip ng isang nanay? Can I still be able to function as a mother if my BP is high? What will happen to my kids if I have hypertension? Will I die because of this disease? What will I do when I get home? When I will inform my husband that I have hypertension? Okay? So may mga ganun class, no? So we are always being taught, especially class with your general systems theory or model, you look at the whole situation rather than one problem. Okay? Class, the portion of the world studied must exhibit some predictability also. Okay? Now, what do we mean by predictability? Tulad kanina lang sabi ko, fever. If I gave paracetamol, I know that the fever would decrease. Pag hindi siya nag-decrease, there's something wrong happening with my patient. Or for example, if you're using already your CNIS, your Clinical Nursing Information System. For example, if I would request for a medication, di ba class nagre-request tayo ng medication, what department nga in the hospital would release the medications? Is it your central supply or your pharmacy? What department would release your medications?
Pharmacy, sir.
Okay, so when we request the medications, we expect that the pharmacy would receive the request. Okay, di ba? We expect that the pharmacy would receive the request. Okay? Okay, kasi perfect daw yung system natin, di ba? Galing daw ng system. Pero, if you have noticed that you requested the medicine and then after 30 minutes, nothing happens, you need to inform the pharmacy. You need to check with the pharmacy what happened. Okay? Plus, there are hospitals here already that are using the tube system. Okay? I don't know if you have been into Metro, for example. Okay? So, plus, there are hospitals already that are using the tube system. Ano po yung ginagawa ng tube system, no? That's referred to as pneumatic tube systems. For example, I requested sa pharmacy. Nag-request ako paracetamol 250 milligrams, okay, something like that. Plus, that medication will be placed here inside a bottle. Tapos ilalagay dyan sa kita yung blue cups na yan, kay or red cup man, depende sa hospital nyo. Paglagay dyan, class, tapos I will just press some buttons. Halimbawa, I will press, this will go to station 1. Class, the bottle would go directly to station 1. So there is no need anymore for the nurse to go down to the ground floor to get the medications. There is no need for the family members of the patients to go down plus to retrieve the medications. Now, kasi class sabi natin may predictability. So kapag nag-request ka ng gamot, after 30 minutes or maybe within 15 minutes, you would expect that medication to be there already. Pag wala pa siya class after the time frame that you have agreed on, you need to follow up. You need to follow up because there is something wrong. It is not what as you have predicted. Okay? Now, as nurses, ang pinaka-common example pa dyan na nangyayari sa hospital is your laboratories. Plus, di ba nagpapalaboratory tayo, no? So, for example, CBC. Plus, if your patient is due for CBC at 8 a.m., tapos 9 a.m. na, wala pa rin nakakuha ng CBC, dapat plus you would need to have your follow-up. Okay? I-check nyo class, baka yung patient hindi pa nakabayad as per your policy sa hospital, or baka class nakalimutan ng medtech, or baka class hindi pumasok sa system ng medtech. Okay? Now nurses do not ever think na, ay kasi tanga naman yung mga medtech, ay kasi tamad naman yung mga medtech. Okay? Uy, do not ever think like that. Do not ever think like that. As a nurse, it's your responsibility to follow up. Okay? You follow up. Sabihin mo, Ma'am Medtech, Ma'am, good morning. Ma'am, regarding patient 1 de la Cruz, I would like to remind lang po na may CBC siya by 8 a.m. Okay? Plus, huwag kang right away daldal ng daldal sa phone, tapos galit ka pa sa phone or sabihin mo, Ma'am, yan kasi ang tanga-tanga nyo. Pagkatapos sasabihin ng medtech na, Ma'am, actually, I just passed by your station, tapos ko na pong kuhaan ng dugo. Okay? Tapos ko na pong kunan ng dugo yung pasyente natin. O sino ngayon ang magmumukhang tanga, di ba? Okay? Plus, and then if I could offer you one advice in the hospital, okay? Plus, other departments are actually your help. Other departments are actually your help. If you're learning how to deal with the patient, they are also learning the same in a different perspective. So wag niyo silang awayin, magtulungan kayo. Okay, so again, main point is that there should be some predictability. Now, every system class, whether living or mechanical, is actually considered to be an information system. Okay? Kasi di ba when we say information, parang iniisip natin information systems ay yan yung sa computer. Ay pag sinabi kong information systems, yan yung nakikita ko. Ano? Okay? Or yan yung parang tinatype namin. So class, hindi po porket tinatype nyo information system siya kaagad. Okay? Pero class, all of those systems, living or mechanical, could be considered an information system. What do I mean by that? For example, ikaw. Okay? Ikaw, you have a lot of information. You share that information to your classmate. You will be talking to your mother in a while and to your father in a while. You're sharing information to your parents because you are an information system. And class, since we are an information system, what do we mean by that? We could always gather data. And there is always something that we can interpret from that system. Okay? Ganun po yan. And a highly complex system, di ba? Could be broken into subsystems so each can be analyzed before being reassembled into a whole. So again, for example, you're dealing with that depressed patients. Class, mahirap intindihin ng mga depressed. Okay? Sorry sa mga nakaranas ng depression ha. Mahirap po yan intindihin. Okay? Pero hindi lang yan sila, no? Kayo mahirap rin kayo intindihin. Ako mahirap din intindihin at times. Now, if there's somebody, for example, who is very difficult to understand, look at one aspect first of the life, and then another aspect of his life, and then another aspect of his life, and then another aspect of his life, and then later on, try to look at it again as a whole. And that will be able to help you understand. Now, Stop na tayo sa depression muna na example. Punta tayo kay alcoholism. Punta tayo kay alcoholism. Class, alcoholics. If you would look at alcoholics and you would try to understand them, okay, something actually may have happened in their life wherein class they felt they had low self-esteem. Okay, they had low self-esteem. Or class, pagkakausapin nyo naman si Tito Freud, can you recall Sigmund Freud? Can you recall your Sigmund Freud? Okay, ano nga class sabi ni Freud? There are 5 stages, di ba? What are the 5 stages according to Freud?
Pressure, anger.
Yes, Dizon?
There's anger. Wait.
Sorry, hindi kita ma-capture. What else? I did not hear you properly. What are the 5 stages according to Freud? Okay, so class, it can be summarized by OALPG. Okay, what are those 5 stages? Uy, nakalimutan nyo na si Tito Freud. Okay, class, your Tito Sigmund Freud. Oral class, anal, tapos di ba may latent, tapos merong phallic. Okay.
Anal,
Mhm.
latent, and
Latent end. Okay, you have your?
Genital.
Okay, you have your genital. Okay? In a while ha, I'm checking, no? I'm checking. Baka nagkamali ako sa order. Okay, nagkamali nga. So class oral, anal, then you have your phallic first before the latent, and then the genital. Okay? Now, just going back to the point about alcoholics. If you would look at the theory of Sigmund Freud, Freud actually tells us that somebody becomes alcoholic kasi po nagkulang po sila sa oral stage. Okay? So baka class kulang ang gatas noon, or baka class wala siyang nakakain way back the oral phase. So the tendency daw is bumabawi siya right now. Okay? So that's why when you want to understand an individual, you need to look at them in a specific sense before you would understand them as a whole. Okay? Another common example is your abusive patients. Okay? Yung mga pasyente nating abusive. Sometimes class, hindi sometimes. Di ba the general notion is galit tayo sa mga abusive. Tama ba? If you would hear news, no? If you would hear news, asawa, sinaktan ang kasambahay or sinaktan kung sino man sa bahay, di ba class, the tendency is that you will react, ay, ang brutal. Kaya bakit nagkaganon? Bakit nagsasaktan? Kaya kasi siguro demonyo yan, di ba? Kaya parang ganyan yung mga notions. Pero as a nurse class, what do you need to understand? People class who are actually abusive or people who are doing abuse are actually people with low self-esteem. Okay? Part po yan ng psych nursing nyo later on, you will know that. So class, for example, no, if narinig nyo for example si husband, sinasaktan class si wife, okay? Class, if the husband always hits the wife, tinatapunan ng kaldero, pinapalo ng kung ano-ano dyan sa bahay, class, actually, the husband there may have low self-esteem problems. Okay? Low self-esteem problems. Sir, bakit low self-esteem tapos siya pa yung matapang? Kasi class sa bahay niya lang napapakita na matapang siya. Okay? Tapos ano naman yung nangyayari kay wife? Si wife class would have the tendency to blame herself. Ano pong sasabihin ni wife? Kasi naman talaga pangit ako. Kasi naman talaga kasalanan ko. Kasi naman talaga hindi po ako sapat. Okay? Class, hindi po yan drama ng buhay. Ganyan po talaga yung mga typical na symptoms ng mga pasyenteng ganyan. So, that husband class, bakit po na siya nagkaganyan? Baka class, it started na sa workplace, nagka-poor performance siya. Pagkatapos class sa workplace, parang palagi na lang siya yung napupuna. Sa workplace class, parang siyang palaging binibelittle. He is being belittled by individuals. So what would be the result? Pagdating sa bahay, kay class, the frustrations and all those anger are directed towards the wife. So kaya, later on, they become abusive. So again, if I would connect that to our point, we are dealing with complex individuals. And for us to understand these complex individuals, you need to look into them one by one. Okay? O kaya, for example, kayo, pag mababa yung grade sa klase nyo, I'm not judging you na bobo siya. Okay? Okay? Hindi ka bobo. Slight lang. Joke. Okay? Hindi ka bobo. No? Hindi ka bobo. But what I'm thinking is that, what might have happened last night? Okay? Nag-away ba kayo ng parents nyo? Nag-break up ba kayo ng boyfriend mo? Okay? And things like that. Okay? So there are a lot of things happening on an individual as a system. Then class as a system is a dynamic network of interconnecting elements. A change in one element must produce a change in all others. Just like you, when you had your transition from high school to college, di ba it's another school? It's another school. You need to adjust. You need to follow another set of rules. You need to follow different sets of uniforms. Right? So there are adjustments. And plus, when subsystems are arranged in a series, the output of one is the input of another. Therefore, class, the process alterations in one require alternations in other subsystems. Now, how would I give one as an example to that? So, for example, class, no, doon tayo sa family. Plus, sabi daw dito sa isang statement ni General Systems Theory is that the output daw of one system is the input to one. Okay? So plus the output of one system becomes the input to one. Now, let's think of our father. Let's think of our mother, okay, or whoever your household head is. They are working very hard. That's their input. The output plus of their work is that there will be money. And then plus that money becomes an input to your end. Okay? Di ba class, ang money, output yan ni father, ni mother, at saka ni household heads natin. Plus that input or that money as their output becomes your input so that you will be able to have your education. And then the expected output plus is that you will have a degree. That demonstrates why one input becomes the output of the other. Okay? Now, tingnan naman natin on the clinical nursing information systems. Plus, in the clinical nursing information systems, okay, you have your subsystems. So, for example, class, you have the nursing subsystem. And then, class, you have, for example, your central supply. No? You have your central supply as another system. Class, ano po yung input? Okay? The input here, class, is the doctor's order. Halimbawa, the nurse class read the doctor's order. Pagkatapos class, the nurse would do the critical thinking, and then what would be the output of the nurse? The nurse will request in the system. Kaya nag-request ka sa system. Halimbawa class, ang ni-request mo sa system, kailangan mo ng specimen cup. Ang specimen cup, guys, usually sa central supply niya nakukuha. Now class, that request in the system becomes the input of your central supply. And your central supply will process it. And then their output will be to release the specimen cup or to release whatever you have requested. And then class, that output naman, magiging input mo na naman as a nurse papunta kay patient mo. So meaning class, ikaw bilang nurse, for example, nagkamali ka ng pagbasa ng doctor's order. Okay? If you made a mistake on reading the doctor's order, your input would be wrong, your request would be wrong, the central supply personnel would also be wrong. Okay? That's the main message here of the sentence. When they said that the process alternations in one require alternations also in the other systems. Then plus all of the systems would go towards, all of the systems would tend towards equilibrium. Okay? Plus when I say equilibrium, that's a state of. When I say equilibrium, it's a state of. Starts with letter B.
Balance.
Okay, very good, no? It's a state of balance. Okay? So class, we would want balance. And all of the systems actually geared toward balance. So, for example, pinaka-common siguro na sinasabi nila is look at water. If you will shake water, if you will try to throw a stone to a body of water, the body of water would become, okay? It would go back to its original state after some time. Then class, the boundary of a system can be redrawn at will by a system analyst. Okay, this is in your informatics. So for example, class, in the nursing subsystems, halimbawa dati-rati, sa system namin, we are not yet able to access some information. But class, the system analyst will be able to say, sige nurses, instead na ganito lang yung data na ma-access ninyo, dagdagan natin. We can increase the data that you have. Okay, class, you refer to those people as your system analyst. Okay, and then to be viable, a system class must be strongly goal-directed, governed by feedback, and have the ability to adapt to changing circumstances. whatever that system is. For example, if you are dealing with the computer systems, class, hindi pwede that your system 10 years ago would be the same system at present. Dapat, class, that system acknowledges feedback. In other words, dapat, class, nakikita niya kung ano yung problema. Dapat, class, nakikita po ng system natin kung saan po nagkakamali. And then that system should be able to adapt to change. Okay? Now, there may be a perfect system, but class, perfection would not stay for long. Okay? There may be a system without fault, but class, that will not stay for long. Okay? So the system needs to adapt. The system needs to receive feedback. Example, in your nursing care, paano po tayo nakaka-receive ng feedback? We ask feedback from our patient's family. Okay, sabi, the class may binibigay na satisfaction survey, pagkatapos i-check ng patient yan whether they are satisfied or not. Plus, if the patient will say they are not satisfied, plus if the patient, for example, will say that they are not knowing anything from it, okay, or for example, hindi ka nila na-appreciate, my dear students, what would happen, no? So, the head nurse will call your attention. So, halimbawa, sasabihin kayo, oy, station 1, mahina daw yung performance nyo. Puro daw kayo suplada. As a nurse class, wag nyo sabihin na hindi kami suplada. Okay? Class, you need to acknowledge that there might be some truthfulness on the feedback of your patient and then you try to improve. In the same way, class, di ba class kadalasan computer? Okay? Tiwala tayo, class, 100% trust tayo, di ba, sa computer. Pero class, okay, you treat the patient, not the machine. Di ba? Ulit-ulit yung sinasabi, you manage the patient, not the machine. So, ibig sabihin, if I pressed something in the computer, and then my patient is not responding properly, my request is not arriving on time, or kung ano mo yung ginawa ko sa computer, pag may hindi po nangyaring kaaya-aya, right away address it, right away report it, because there might be something wrong in the system. Many times na itong nangyari sa amin sa hospital, no? For example, nag-request ako ng medication, hindi daw na-receive. Ayun pala, class, no? Ayun pala, yung setup ng computer, naka-silent po pala yung notifications. Hindi po hindi si pharmacist, for example, yung nag-silent. Okay? It so happened that pag-update, parang yung default ng update is i-silence yung notifications. Whereas, ang another department, sanay na kapag may bagong request, mag-beep. This time, hindi po siya nag-beep because of the update. Okay? So, you need to have feedback and then you need to adapt to changing circumstances. Okay? That's the main message of your general systems theory. Okay? In the next discussion, I'll be talking about change theory naman. Unless if you have any questions,